Introduction to Women's Health Practitioner. Introduction to the module. Women's health is the area of medicine that specializes in treating and diagnosing illnesses and problems that impact a woman's physical and mental health. The Women's Health Nurse Practitioner's WHNP's responsibility is to evaluate, identify, and address the healthcare needs of women at all stages of life. Many WHNPs work in private practice settings, offering preventative care like well woman checks, breast cancer screenings, Papa Nicolau, PAP, testing, or help with contraception. In this module, we look at the overall role and career of a women's health practitioner. Learning objectives. At the end of this module, you'll be able to define women's health nurse practitioners, understand the importance of women's health nurse practitioners, describe the WHNP work process, recognize the responsibilities of women's health nurse practitioners, discuss WHNP educational requirements and salary. Who are women's health nurse practitioners? The term women's health nurse practitioner, WHNP, refers to an advanced practice registered nurse, a PRN, who focuses on providing comprehensive care for women of all ages. They focus on gynecological, obstetric, and reproductive health. WHNPs not only provide diagnostic services and treatments, but they also put a strong emphasis on maintaining preventative health. WHNPs are different from certified nurse midwives in that they focus mostly on primary care and follow women's health throughout their lives. Importance of women's health nurse practitioners. WHNPs differ from doctors because they take a more integrated approach to patient care. Since they are nurses, they evaluate the patient's needs, including their physical, psychosocial, and environmental requirements. Additionally, their analysis is not limited to women's health. Because they can also deal with chronic health problems, primary care has a significant role. It is ensured that every facet of a patient's health is handled by working together with doctors and WHNPs. WHNPs are expert educators who may spend time educating patients and their families about diseases, the disease causes, ways to prevent them, in addition to addressing immediate health problems. They utilize the nurse's process to assess specific needs, analyze options, create a plan of care, and evaluate the effectiveness of the treatment plan while involving the patient's family to optimize care outcomes. Nurse practitioners claim a central role in health promotion and prevention for women of all ages. NPs screen women for STIs, cancers, depression, and domestic abuse, provide care for lesbian and transgender women, provide care for menopausal women, and educate women of all ages on nutrition and wellness topics. Qualities of WHNP. Nurses who enjoy practicing independently and wish to diagnose and prescribe while still utilizing nursing skills make excellent nurse practitioners. 1. Autonomy, ethics, and leadership are other qualities that those who want to pursue their NP should cherish. 2. In women's health, nurses should enjoy educating patients, interacting with women from various backgrounds, and encouraging preventive and holistic health. 3. They should have the ability to establish strong bonds with others and maintain their objectivity when dealing with people whose values and preferences may differ from their own. Scope of WHNP. Due to their expertise in education, WHNPs may diagnose acute health problems and spend time educating patients and their families about illness processes, treatments, and preventive health care to improve care outcomes. They work with the patient's family. Apply the nurse's approach to identifying specific requirements. Consider options. Develop a plan of care. Review the efficacy of the treatment plan. WHNPs are also critical in improving access to care. Women's health nurse practitioners are already beginning to fill the gaps, as primary care physicians are expected to experience a deficit of between 7,300 and 43,100 physicians. Eligibility requirements. Past registered nurse, RN, clinical experience may be necessary for graduate programs. Some programs permit RNs to work, allowing them to complete the degree while gaining experience. In order to better prepare them for advanced practice nursing, nurses can use this opportunity to develop and polish their skills in the area of women's health. Courses relevant to the Women's Health Nurse Practitioner track and general advanced practice courses must be completed for master's degree programs. Courses in general advanced practice covering ideas like health promotion and maintenance, advanced pathophysiology, advanced health assessment, Pharmacology for advanced practice nurses. Depending on the school, the curriculum for WHNP can vary, but core concepts include the following: primary care of adolescents, perinatal care, gender or women's health across the lifespan. After completing a graduate program or attending a school like the National Certification Corporation, women's health nurse practitioners can become certified, NCC. Qualification standards include current RN or NP license, completion of an accredited graduate NP program. Completion of the exam must occur within 8 years of graduation. Electronic submission of diploma and transcript. Postmasters applicants must electronically submit their certificate of completion. Nurse practitioners specializing in women's health must register with their state's Board of Registered Nursing. Nurse practitioners are advised to verify their state board for requirements as they may vary from state to state. Duties of WHNP. WHNPs have a wide range of responsibilities because they care for women throughout their lifespans. Responsibilities could include conducting well-woman exams, reviewing preventive health needs, educating on available contraception, allowing patients to make informed choices, prescribing medication or contraception, inserting long-acting reversible contraception, educating or counseling on unexpected pregnancies, ordering and interpreting blood and imaging tests, addressing infertility concerns, sexually transmitted disease diagnosis, treatment, and education, managing women through the perinatal period, menopause education and counseling, intimacy and sexual health, screening for domestic violence, substance abuse, and high-risk behaviors, diagnosing female-related disease processes. Career path and progression. The healthcare team must include nurse practitioners. Their holistic approach to patient care enables them to give more comprehensive care to their patients, which enhances patient outcomes and increases patient satisfaction. Working conditions. Women's health nurse practitioners can work in the following areas: primary care clinics, women's health clinics, student health centers, community health centers, hospitals. WHNPs' working conditions might be both advantageous and disadvantageous. WHNPs often experience stress because of their high patient loads and occasionally challenging diagnosis. Patients who are given unfavorable news must control their emotions while expressing sympathy. There is also no space for error, which might raise everyday stress levels. WHNPs may also need to be on call, work swing, graveyard shifts, and weekends or holidays. It can be quite satisfying to specialize in women's health. They frequently form strong, enduring bonds with their patients. They are the ones who provide care and knowledge about family planning, prenatal health, and menopause throughout the lifespan of women's health. They may assist in diagnosing serious conditions, including breast, cervical, or ovarian cancer, and support patients throughout their therapies. Salary. The average salary for a nurse practitioner is £34,576 per year in the United Kingdom. Salary amounts can fluctuate due to location, city or state, the nurse's experience level, any additional certifications held, and the employing organization. Highlights from this module. The WHNP's responsibility is to evaluate, identify, and address the healthcare needs of women at all stages of life. For graduate programs, having previous clinical experience as a registered nurse, RN, may be required. Women's health nurse practitioners can earn certification by finishing a graduate program or enrolling at a university like the National Certification Corporation, NCC. The average salary for a nurse practitioner is £34,576 per year in the United Kingdom. Thank you. This module has ended. Hope that you have learned something valuable.